Double eyelid blepharoplasty scarring and swelling problems after 3 months. The procedure was incisional, and I had fat removed with muscle correction on my right eye. The area under the incision crease is still very swollen. The area also has very little sensation to touch. The incision on my right eye, towards the inner corner, sometimes stings. There are some bumps along the scars as well. Is this all normal after 3 months? Is there anything I can do to solve these problems?
Thank you for your question. The details about your history is appreciated, and it certainly gives me an understanding of where you're at in the time frame since your upper eyelid surgery. You recount that you had eyelid surgery with fat removal and incisional type, and that you had muscle correction on one eye. So, that being said, you're concerned about scarring and swelling, and you noted that there's a diminishing of sensation in the area that you're describing that is also part of your concern. So, first of all, the very important factor to understand is that when you have Asian eyelid surgery, swelling in this space between the eyelash margin or the eyelid crease, also referred to technically as the pretarsal area, is very much of a normal experience. And it is variable from individual to individual, the amount of swelling and the length of time that the swelling can occur. So, to address the swelling concern, it is, from my experience, not unusual for you to still be experiencing this type of swelling at 3 months. I often tell my patients that this particular type of surgery almost creates a limitation in the egress or displacement of fluid during the normal healing process, and it's just something that each individual will ultimately see a resolution of their swelling, but it can take 6 months to a year. And very often the 3-month point is a transition point where the swelling can significantly change and diminish. Now, again, this is a critically important thing, is to have an ongoing dialogue with your surgeon. Although you are very concerned and it is understood that you want to get additional perspectives about your healing process, only your surgeon was there for your surgery. And every surgeon has a particular style in how they do their surgery, as well as their own experience as to the process of healing for their type of surgery. So when I look at your photos, the incisional lines certainly look a little bit on the thicker side, but as I explained before, there is an ongoing process of healing. When I do an incisional Asian eyelid surgery or any upper eyelid surgery, I always tell my patients that for the early postoperative period, defined as typically the first month, but even longer than the first month, the collagen that is being used from your own body to heal the incision is in a disorganized orientation. So it's almost like it's all kind of just patched together. Then the body goes through a process called wound remodeling or wound healing or collagen remodeling. But the point is, it goes from being irregular and lumpy to parallel and soft and flatter. I particularly do this because I want to help our patients avoid getting a lot of well-meaning advice where people will tell them to use any of the over-the-counter anti-scar medications. Very often the oils and the preservatives and other chemicals in those can actually make the scars become worse. So I monitor my patients closely. I see them at 1 week, 1 month, 3 months, and as often as they need to, but with our schedule, we see them pretty closely. And so we can observe their healing process and get the feedback about what they're doing on their own. Sometimes patients will do things that they think is good for them and end up doing something that actually causes inflammation or irritation. So communication is so important with your surgeon about what you're experiencing. When I look at the area between the transition of the eyelid and the epicanthal fold, it looks a little bit raised, it looks a little bit thick. Now your surgeon will know if in their experience for their surgery this is typical. Somebody from the outside can examine you and say, okay, well maybe for them it's atypical or unusual, but for your surgeon it might be typical, and then in the long term it ends up being fine. The point is that when you decide to get additional opinions, you have to be prepared for a different style in the approach to your healing process. And some may recommend doing something like a steroid injection or something to reduce the thickening of the incisional line. But this is a process in time, and since anybody who looking at you from a different perspective will have their own ideas, it may confuse you even further. So just be cautious about that. I'm pretty confident that you did your research before you chose your surgeon, and so most likely your surgeon has proven to you that they have the necessary experience to do this type of surgery. And so most likely this is somebody who has that type of experience, who can guide you as to what's going on and what to anticipate. So I think from your submission of this information, I can share with you that incisional lines can be thick at 3 months, that swelling can be elevated for 3 months and beyond, and that and both of these things can be, of course, unsettling. And in a world where so many things happen fast, the human body is still a product of evolution, and so things do happen slower, and sometimes it tests the patience of both the patient and the surgeon in waiting for things to fully develop and heal. So I hope that was helpful. I wish you the best of luck, and thank you for your question.